Hi everyone, today is day 3 post-op from my sleeve gastrectomy. Today is actually Friday. I had the surgery on Tuesday just gone. As I mentioned in my brief iPhone upload, I had a pretty rough first 5.5 hours. Yeah, lots of pain, nausea, vomiting, but once we got on top of that, and everyone was really quick to get on top of it. I was seen by a doctor. They've done an ECG to make sure my heart was fine because of the pain that I had in my chest. My anaesthetist was there, basically just seeing what they could do with anything medication wise to get me sorted, and they did. So I actually woke up in recovery at 11 a.m. and it was 4:30 p.m. By the time I actually felt like, wow, okay, I can breathe, it's done. But from there onwards, every day has just gotten progressively better. I'm going home today, which was always the plan. My doctor likes you to stay 3 nights. For me and my doctor, the plan for us is the first night in the high dependency unit. You have an arterial line, you're not allowed out of bed, and only allowed ice chips. I had started on the ice chips, but because of the vomiting, I actually then vomited up watery blood, so then that was put a stop to that for quite a few hours. But by that evening I was onto the ice chips. So then on day 1, you're allowed clear fluids, and I actually amazed myself with how well I went. I was moved to my own private room. It's lovely, my own air conditioner, bathroom, television, window, quiet, though HDU was quiet too, really, considering it had 5 patients in the one room. I think I really was the one that needed the most attention that evening. So yeah, I actually managed to get about 800 mils of clear fluids in on my first day, so I was really happy with that. I was still on the IV fluids and still on my patient-controlled analgesia button, which was fentanyl. Had that, so then we went into day 2, where you transition into what they call full fluids. Full fluids is roughly said by my dietitian as anything that can go up a straw. Still focused on hydration. Was finding both yesterday and today the mornings are particularly more painful to get those first few little sips in. My dietitian explained that's very common early on. The saliva sort of forms like a film, like a spiderweb over the top of the stomach. So yeah, that sort of film that sort of covers, she said, makes it quite difficult to get those first few sips in. So she actually suggested that your first few sips be actually something warm, even if it's just warm water, and that helps sort of dissolve that, so that then you can progress on for the day. So that was a good tip. So yesterday on the full fluids, I had things like yogurt, which tasted amazingly sweet. Wow, blew my head off for the breakfast one. But by the time I had the evening one, even though it was exactly the same, didn't taste near as sweet. My dietitian said that that's also due to the anaesthetic. Also had some soups, a strained porridge, a cup of tea with milk. So yeah, just sort of worked the day along. Was still finding inconsistencies, I guess. Sometimes my first sip would give me a real pressure sore feeling in the chest, so then I would need to stop and wait 10 or 15 minutes. But then other times in the day, I could have 3-4 tablespoons of soup easily, then get the discomfort, so then stop. I guess, yeah, it's early days. As my surgeon said this morning, everything is still very swollen, and to not get too caught up in these very early days around, anything really other than hydration. So yesterday on day 2, that was also when they capped off my IV fluids and also took away the fentanyl pain pump. So they left the IV cannula in just for the day, just to be sure, and I was changed over to regular Panadol, paracetamol, and endone, 10 milligrams of endone. So I think the other name's hydrocodone for that. And I could have that every 8 hours. The Panadol, I was breaking them in half to start with. By this morning, I'm able to swallow the whole tablet. I take medications for other things and was able to swallow tablets from very early on, so I was impressed with that, as long as they weren't, enormous ones. So went through yesterday. By the afternoon they were happy. Yes, I was hydrating, I was going to the bathroom, so then they removed my IV cannula, so then I was free of all attachments, which was lovely. Roll into today, day 3. Not at all interested today in much of the free fluids. Had the strained porridge and the yogurt, really struggled, just wasn't enjoying it. It was giving me that same uncomfortable sensation. So I decided not to push it and just focus again on hydration. So whilst in hospital, they've been giving me apple juice and water and saying dilute it, 50-50. But my dietitian has said that once I go home, obviously, to try not to have too much of the juice, being high in the sugar. But at this stage, yeah, that's okay. I have had a friend who has still, even though now sleeved, I think 8 months, 7-8 months, drinking just plain water and getting that discomfort. I don't seem to have that, which is great because I love my water. My dietitian seen me this morning, my surgeon seen me this morning. I'm just waiting for my husband to come and collect me. We discussed sort of the plan for the next ongoing few weeks. I see them again in, would be 2 weeks, 2 weeks today. And they've just said, continue on, obviously try to get some good protein in there. My lovely husband has made up some lovely protein rich soups for me that we've frozen, so I'll have that, some yogurt, and she did suggest that I could do OptiFast. Not keen to do full OptiFast. I have done it before in my life, but I didn't mind the strawberry and the banana flavours this time. So she suggested, smoothies, are awesome, especially if I add the yogurt with the protein. But she said, maybe make the smoothie with a half a sachet or a full sachet of the banana or the strawberry OptiFast and add some fruit and yogurt. And that way I'm getting, a few extra nutrients. So I think I probably will do that. I have a few left, so I think that'd be a good way to get some nutrients in. Other than that, I asked my surgeon when I could resume exercise, mainly really just interested in treadmill, just gentle walking, because that's something I'd started prior to surgery. He said as soon as I'm ready I can get back on, but to not push myself or run for at least 2 weeks. Thought of me running is hilarious, so but usually I like to push myself with incline, do some hills and programs, so I'll just take it as my body takes it, I guess. I dare say I felt quite fatigued and needed a few little rests, so I'm sure it'll be like that for a little while till my body adjusts to everything. I've got like a clear film and steri strips on my 5 little wounds. Asked him about what needs to happen there. Basically, wait till they're almost falling off, which will take a week or 2, then take them off. That was it. I'm given some endone to go home with, just if the pain is bad, but obviously not trying to use too much of that. Take regular Panadol, and I've also gone home on Nexium for reflux. I was on a different drug for reflux, which I actually only started a few months ago, and only in my life if I needed it when I've sort of reached this sort of peak weight, so we'll wait and see, I guess. I'm fully prepared that I may need to take the Nexium forever, depending on my sleeve, depending on my body. You know what? It's a small price to pay. So overall, very happy, very excited about the next part of the journey. Can highly recommend walking. Sorry, interrupted by the phone. Yeah, definitely recommend getting up and walking when you can, even if it's just up and down the hallways. I found I was passing like wind burping, small burps, but it's really only been today that I'm actually getting proper wind up, and it's really only been since late last night that the other end is starting to move along too. And my dietitian has said, you know, this discomfort that I have at the moment is probably still mainly trapped wind gas. So the quicker that I can get that out, the easier and more comfortable I'll be. So that's my update. Yeah, bring it on. I'm so ready. I can't wait to see what 2015 and the rest of my life brings. And yeah, I can't wait. Thanks everyone. I'm going to aim to update at least weekly, maybe more often if there's something interesting to report. Alrighty, thanks everyone. Bye.